All right, I'd like to call the March 9th, 2023 Health Committee meeting to order. We have 5 members present, so we have a quorum. Minutes from February 9th, 2023 regular meeting for approval. Motion by Johnston, second by Metzger. Any additions or corrections? Hearing none, all in favor, say aye. Aye. Any opposed? Okay, moving on. Do we have any members of the public?
No, we do not.
Thank you. Departmental matters, Tim Wiley, Nursing Home Administrator, is up first. Hi, you have an item for action. Request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance for Fund 401, which is just cleanup, I believe. Motion by Metzger, second by Wendt. And this is just our annual cleanup. Correct?
That is correct.
Okay. Does anybody have any questions? Hearing none, all in favor? Any opposed? Okay, that's approved. And then you have your monthly report, and I'll let you make any comments you'd like to make.
Well, first of all, I want to thank the committee, as always, for your support and appreciate all that you do. And then I also want to thank the County Health Department. We had a wonderful presentation on trauma-informed care today. So if there are any other departments in the county that would like training on it, Amy does an absolutely splendid job. So thank you for assisting us with that. The January numbers continued forward some of the trends that we saw in November and December, but the end of January into February and continuing into the first week of March, we're seeing census and a lot of the statistics getting back to where we wanted to see it. In fact, the end of February, we had as high as 14 Med A's, and our census got up to 94. So we're finally trending back where we want to be. I'll give you a little preview. February agency utilization was 15% of our nursing shifts, so we're continuing to move in the right direction there. We're now up to 144 employees, and we're excited about moving forward for what 2023 has for us.
Great, thank you. Member Johnston.
Just had a quick question after reading the report. You did mention that we had, I think it was one of the highest census for the Serenity Lane with the hospice care. Can you speak to, was there anything in particular that had brought those numbers up, or are patients and their families going back and having wonderful things to say about the nursing home? What's kind of pushing those numbers up?
I believe a lot of that is word of mouth, and a lot of that is word being spread by the hospice companies themselves. They are wanting, what we're hearing is they are wanting their clients there. When their clients are no longer able to stay at home, they want them at McLean County, and we're excited about that.
Do you know what kinds of things that they're saying as far as why we're advantageous for that?
Sure. The involvement of the nurse management team is incredible. They're very thorough, excellent communication. We require excellent communication from the hospice companies as well, because we advocate for the residents and for the families at that time of life, which is extremely difficult. The environment also, I think, plays a key role. It's the appropriate environment for that situation, as opposed to in other locations where they're just integrated with all the hustle and bustle that's going on. So I think it's all coming together really well for us.
Excellent. I'm glad to hear that. Thank you.
Number one.
Yeah, I'm new on this committee. I used to be on this committee a while ago. But how many patients do we have now in the nursing home?
We have 92, but we have 4 admits pending, and all 4 of them are Medicare or skilled, which is our best reimbursement, actually.
Yeah, what percentage are Medicaid?
We have 46 Medicaid out of the 92, so 50%,
Yeah,
which I try to keep it around that number. But let me just mention this for you. Our Medicaid reimbursement rate is near equal to our private pay rate right now.
oh, is it?
Yes, sir.
Well, that's a new
Yes.
amount, because back when I was on this committee before, there was quite a difference between it.
Yes.
And then what's our maximum load that we can have? How many patients could we have?
Well, our maximum capacity for licensure is 148, but I've been working on what I referred to as an operational capacity that is taking into consideration what the market would like. They would like for short-term rehab and for hospice situations, they're going to like more private rooms. And so that we kind of have an unofficial operational capacity of 123 or 124, which provides these private rooms for those two specific settings. Plus, it's much easier in this day and age to staff for 120 than it would be for 148. And my initial goal for this year is if we have that operational capacity at around 123, 124, and we operate at 85% of that, that would be 105. So that's really where I would like to see us getting close to consistently running around 100.
No, you said hospice. No, we take hospice patients,
Absolutely.
and then what does Medicare pay for that?
Medicare actually pays the hospice agency, but we get the private pay rate, or we get, the hospice agency then pays us the Medicaid rate,
Okay,
which again is close to our private pay rate.
that's kind of interesting. My son-in-law works for a hospice
Okay,
operation that puts people in hospice all over the country. But his biggest problem is hiring nurses. That's what his,
yes, sir, I can relate to that,
yeah, you could relate.
yes.
But you said you were fully staffed now. Is that-
No, we're at 15% of our nursing shifts are covered by agency, 85% are covered by our own employees.
Okay, so we still have, where we're having an agency have to fill in.
Correct. Right now, of the agency shifts, which we're only averaging around 30 shifts a week of nurses, but only 5% are CNAs. We're about to be fully staffed with our own CNAs. Nurses are just extremely hard
Oh, I know.
to find right now.
You know, they're all going to Florida. Or,
I just actually attended an administrators conference, and I want the county to know how proud I am of being a part of McLean County. I was frequently asked how things were going with staffing, and as I shared with these other administrators our staffing situation, it was very encouraging to watch their jaws drop because they're not used to hearing success stories.
well,
But we're moving in the right direction.
because everything I see on Facebook is they're advertising these high wages for nurses
Correct.
and bonuses to sign up and
Correct.
stuff that we probably can't match.
We believe that the secret to our success is a positive work environment.
Yeah, well, that helps.
Okay,
Very good.
thank you.
Thank you.
With what Member Johnson said and asked about the census numbers on Serenity Lane, do you foresee enlarging that at all? I mean, when you just talked about, too, about the capacity of different areas and the need for that in the community.
I think we're positioning it, and the, excuse me, the neighborhood utilization, I think we're at the right spot of, we've created more private rooms, which will turn into suites with little dinettes and in-room dining so the families can have privacy. with the people who are at that point. So I don't know that the capacity needs to increase. We're not going to decertify beds anytime soon in case we run into that very wonderful problem to have. But I think where we are right now and where we're wanting to go is consistent with what an honest market share would be for that. But there is a possibility, one of the things that I'm keeping in the back of my mind is understanding the criteria for being a full-fledged inpatient hospice care facility in just the 200 hall. That would put us, if we get to where we meet the criteria for that, then we would be collecting part of the Medicare daily reimbursement for hospice care. But we really need private accommodations for that situation.
Okay, thank you. Anyone else have any
I
questions?
just have one more.
Member one.
Just curiosity, what is the daily rate now for private?
I believe we're at 240.
240?
Forgive me, I should know that off the top of my head.
Thank you.
Anyone else? Okay, thank you.
Thank you.
Next is Jason Tabb, Juvenile Detention Superintendent. And I do want to thank Mr. Wiley for our nice tour last month that we had. That was very good with the banana cake. That was tasty. That the Juvenile Detention Center probably got some of too.
I believe we did.
And you have an item for action, request approval of an affiliation agreement with Heartland Community College. Do I have a motion? Motion by George, Member Went, second by Member Biles. Would you like to explain this one to us?
Yeah, this is a pretty standard agreement that we had a number of years ago that allows Heartland to send us nursing students to do clinical on-site with our nurse, now that we have one full-time. We're looking forward to bringing them back in to let them have that clinical experience.
Members have any questions? Member Biles.
Member Abraham had asked me to relay a question that he has. Specifically, he wants to know if there's a process in place for children to deny interacting with the Heartland student, if they have, if there's any sort of process that could be implemented that gives them options.
Yeah, any resident that doesn't want to have someone else on hand or in any kind of questioning with the nurse, yes, they'd be able to request not to have them there.
Perfect. Awesome. Thank you.
Okay, thank you. Previously when we had this, was there always individuals that were wanting to come?
Yeah, every semester, and we're currently working with ISU as well. We have a number of nursing students, they're coming out at least once. I think we have 2 students almost every Monday that come on site all day. So yes, in the past with Heartland, we have had a number of students come out.
Okay, thank you. All in favor?
Aye.
Any opposed? Okay, that passes. Now you have your monthly report. Is there anything you want to point out on that, or?
No, pretty standard, pretty straightforward for January. Census was down a little bit, so contacts were down a little bit. Some of our high mental health, I know that's the one we're focused on, the high mental health kids, some of those kids have moved on. So the contacts with therapists are down.
Anyone have any questions? Okay, thank you.
Thank you.
Next is Shannon Miller from Advanced Correctional Healthcare, which I do not see her.
Shannon is not here this evening. If you have any questions on her report, I'd be happy to relay those and get you responses.
Member Johnston.
I did have a quick question for her. I guess about 1.5 years ago, I had taken a tour of the jail that had been offered by Sheriff Sandage, and he had mentioned that during COVID, they had been doing when they brought new inmates in, they had been isolated for 2 weeks just for COVID purposes. but he'd also found that it was pretty helpful for them just to acclimate to being in jail themselves. But I was curious, just from a health standpoint, are they still following that protocol, or they're isolating patients in case of a COVID case, like in case the inmate has COVID? And that was one of the questions. And then looking at the numbers of the COVID PCR tests, are those mainly on people coming in or people that are suspected? Because I was just trying to get a sense of where the testing is being done. Is it people coming in or people who are inmates? Existing. Those are my questions. Thank you.
Anyone else have any questions? Okay, moving on, Jessica McKnight, Health Department Administrator. And you have a bunch of items
I do, I have several action items.
for action. And I don't think we can we do these all together since they're all just cleanups? They're just for different funds?
Yes.
Okay. Does anybody have any objection to that, except for the last one? We have to do the last one separately, but A through E, anybody have any objection to that? Okay.
Yeah, E is for
Right,
2020.
except E, yeah, E's gonna be,
No, E is 2023, the others are 2022.
oh, okay,
So
E and
we may
F,
need to separate that one.
A, B, C, and D, okay. We're going to have one motion to request approval of the emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance for Fund 105. B is request approval of emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance for Fund 107. C is request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance for Fund 110. And D is request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance for Fund 135. That's 135. That's not the health department. Hang on a minute. So we should do that one separate then. So it would just be A, B, and C. Okay. So now, the last one. Motion by Biles, second by Johnston. Any discussions? Hearing none, all in favor? Any opposed? Okay. So now we'll do D, which is request approval and emergency appropriation ordinance amending the McLean County fiscal year 2022 combined annual appropriation and budget ordinance for Fund 135, which, like I said, should have been under jail medical. Motion by Johnston, second by Metzger. Any discussion? Hearing none, all in favor? Okay, then request approval of emergency appropriation item ordinance amending the McLean County fiscal year 2023 combined annual appropriation and budget ordinance for Fund 107. Motion by Metzger, second by Wendt. And this is the carryover.
Yes, a no-cost extension for COVID response grant, so just allowing us to use the unexpended funds we had in 2022 now through June of 2023.
Question.
I just had a quick question on, for the amount that is remaining, do you see that lasting through the end of June, or are there going to be unutilized funds in June?
It is possible that there will be unused funds, but we're trying our best to spend them down. It's been kind of the trend across the state with the COVID monies that they continue to get extended, but we're trying to make sure that we spend all of this by the end of the time period.
Okay, all right, thank you.
We got more COVID money coming?
We do, yes.
Found out
More-
last night at Board of Health, we have more
Yeah,
COVID money
more
funding.
extensions, more grants coming, so it's been 3 years now of continued, which is good.
Any other questions? Okay, all in favor? Any opposed? Okay. And last item for action is request approval of proposed amendments to chapters 205 fees and 216 food service from the McLean County Code, and a motion by Went, and second by Biles. And you want to talk about this, because this is a lot of new stuff.
Yeah, I can do my best, and we also have our Environmental Health Division Director here as well, Mr. Tom Anderson. If there are questions I am not able to answer, he can help out. But this is in result of a Senate bill and legislation that went into effect in January, requiring the food permits. And so it's a change in the type of permits then that would be needed for the events. So in the end, currently, vendors are getting multi-temporary event permits that are costing them $180 for 6 months or $360 for a year. And so this actually is a lower, and they can have options based on what they're actually going to be selling. There's more than one option than just the single permit.
Any questions? Member Metzger?
So the only thing that's really changing are the underlying things. Is that accurate?
Underline things,
Anything that's underlined, is that the changes?
it's all,
Or it's the
it's all
entire?
new, yes. So it's an
Okay,
entire new section.
so I do have some questions, and it has to do, page 40, 2 different types of market permits. Market egg permit, that they are available to any offering only eggs to the public, and then the one that offers eggs, poultry, frozen. So we have a lot of that. I've seen it not at some of the smaller communities like at Carlock or Hudson, but definitely in the Bloomington. And so, are we reaching out to the people and letting them know that they've got different permits? And, I mean, I'm sure they're not going to object to have a lower fee, but I think they need to understand the difference. And so how is that being communicated?
Sure, so obviously inspectors, when they were going to the farmer's market to do inspections, were providing education about the upcoming, so the imminent bill that was going to be legislation going into effect in January last year. And then we also had a public hearing, which we notified all the vendors about, so they could come and provide any input on the setting of these fees as well. So education has been provided to the vendors
And how was that received?
pretty well. Yeah.
I
pretty
mean,
well.
did we have people show up, I guess, is
Oh,
where
so
I'm.
yeah, not to the public hearing. We didn't have anyone show up.
Okay. And so this entire section then is being added to our code?
Correct.
Okay. And how does, what would cause somebody to get their permit revoked?
I'd like Mr. Anderson to come up to the
Yeah.
table.
And I know, I'm sorry, Jessica, I
That's
knew
all
that you
right.
probably wouldn't know that, but I just see that we're talking about things getting revoked and how, what the process is to get it back, and
So it would take an egregious action upon the vendor to have their permit revoked. The Illinois Department of Public Health strongly emphasizes that we use educational practices to inform the vendor of the reasons why they should change their processes. That is a standard language all throughout the ordinance. So under food establishments, under bed and breakfast, under temporary food, you will see the same language. It's there for enforcement purposes in the unlikely event that we do have to work with the state's attorney's office and seek legal action against the vendor.
okay, thank you very much. And I think that's all I've got at this point, so thank you for your proactive efforts to make this move smoothly, because I know many people appreciate having those opportunities to interact and obtain their food directly from a provider. And we certainly don't want to get in the way of that. We want to help that move forward. So thank you.
Anyone else have any other questions? Okay, hearing none. All in favor? Any opposed? Okay. And you have your, you have items for information. The first one is about a dental assistant.
Yes, so this was presented last night at Finance. Really us looking at our staffing and doing a little bit of reorganization based on our needs. So changing one of our administrative support positions, upgrading that to add some additional dental assistant duties. We were needing a dental assistant, and so an opportunity for advancement for some of our employees, but also getting some of the things that we need done in vacant positions that we have.
Any questions on that? Okay, and then you have your general report. Anything you want to say about that?
I do. Just this month was highlighting the Environmental Health Division, so their January, February, I believe, actions. So Tom is here if you have any specific questions. It's a rare opportunity.
Member Johnston.
I did have two questions. Because some of the rationale wasn't highlighted, I noticed that we didn't have the same number of food permits renewed, and I was wondering if that was because there were establishments that closed or may potentially be in, default? What is it called? Unpermitted?
And Tom can correct me if I'm wrong, but I believe that we end up with, if it's not the same number as last year, then they're not operating or they didn't get a permit then for this year.
Okay. The other question, I think more speaks to Mr. Anderson, is that I noticed we didn't have the same number of vendors apply for septic inspection. And I was wondering if that was going to create a hardship, or will it be okay? I mean, I just don't want people, if they're needing support with septic tanks, that they're waiting if we don't have enough vendors. That's not something that you want to wait on.
When you refer to vendors, are you referring to the installers?
Yes.
So the business for installation is driven by the demand.
Okay.
Right now, development in Illinois, all throughout Illinois, has been low in the rural areas. So some installers have moved on. The ones that we have are longtime family businesses located right here in McLean County, and there's enough business to keep them going. We do have an evaluation program that helps them throughout the year. Septic systems are required to be evaluated by the Department of Public Health at certain intervals. And then the lending institutions, since about 2000, have required buyers to get a septic evaluation before they offer a loan on a house. So that keeps them in business. They're the third parties that do those types of inspections. So it's all driven by the demand.
So, but we're not seeing like a massive shortage and people are
No,
not going to be.
not at this time.
Okay, thank you.
Anyone else have any questions? Okay, thank you. Next is County Administrator Cassie Taylor.
Thank you. I have nothing to present for this committee tonight.
Under other business and communication, our next meeting is Thursday, April 6th at 4. Does anybody else have any other business to bring before the committee? If not, we have bills, and we also have transfers that are in your packet that need approval. Do we have to do this? Okay, bills and transfers. All right, Board of Health has a prepaid total of $330,741.11. Motion by Biles, second by Johnston. All in favor? Aye. Any opposed? Okay, nursing home has a prepaid total of $487,327.54. Motion by Johnston, second by Metzger. All in favor? Aye. Any opposed? Okay. Jail and JDC Medical have a prepaid total of $27,177.38. Motion by Metzger, second by Wendt. All in favor? Any opposed? And the Developmental Disabilities Board has a prepaid total of $121,776.83. Motion by Wendt, second by Biles. And all in favor? Any opposed? Okay, and with that, we are adjourned. Thank you.